Hello everyone, and thanks for joining me this evening. My name is Scott Royer. Tonight, I will be debating the argument that implementing school-based physical education interventions are the key to fighting childhood obesity. To begin, I would like to give you a few statistics and definitions that I believe are essential when discussing this argument. According to the Center for Disease Control, overweight is defined as having excess body weight for a particular height from fat, muscle, bone, water, or a combination of all three factors. Similarly, the CDC defines the term obesity as having excess body fat. Serious health implications are directly related to excess body fat or obesity. With those definitions in mind, let's take a look at where our nation stands with the current childhood obesity epidemic. In the past 20 years, the number of overweight and obese children in the United States has tripled, with more than 1/3 of children and adolescents reported to be overweight or obese. Serious health implications are directly related to obesity or excess fat. Children who are overweight and obese may suffer from negative short-term and long-term health effects, as we all know. Short-term, obese youth are higher risk for cardiovascular disease such as high blood pressure or cholesterol. These short-term health issues increase the likelihood of a child experiencing long-term health effects such as heart disease, type 2 diabetes, stroke, and several types of cancers. The recent rise in childhood obesity is largely due to the complex changes in the social and physical environment of adolescents and children. As we all know, children like to sit around more often than not on their computer playing video games, and a lot of that kind of stuff has led to the obesity crisis as we know it. There are still strategies, though, however, to prevent and combat childhood obesity. The prevention of obesity in children, it starts with instilling healthy habits at a young age. If habits such as eating healthy, daily physical activity are learned in adolescence, the risk of becoming obese and developing related diseases can decrease significantly. Many of these healthy behaviors are influenced and developed by different sectors of society, such as families, communities, child care settings, medical providers, government agencies, the media, and most importantly, schools. Schools play a critical role in establishing a healthy environment for children with policies and practices that establish healthy conduct every single day. Children spend hours in school each day, providing schools with the perfect forum to educate students on healthy behaviors. At this time, guidelines recommend that children partake in moderate to vigorous physical activity for at least 60 minutes or more each day. Daily physical activity such as this has been shown to decrease obesity rates and the negative health issues associated with it. Conversely, physical inactivity is considered a significant contributing factor for childhood obesity. Even with these known facts, studies show that only a small number of children have daily physical education classes each day, and when they do have physical education, they aren't active for very long, actually less than 50% of the time. Developing and instilling programs that increase health education and physical activity at school have been shown to decrease obesity rates, improve health, and overall are the key to eliminating the childhood obesity epidemic. Research is currently available that supports the notion that carefully designed health programs and interventions can improve youth fitness and reduce childhood obesity. In 2007, a study done by Rosenbaum and colleagues examined the effect of a 4-month school-based intervention consisting of wellness and exercise classes in 73 8th grade students in New York. Participants were separated into an intervention and a control group with body fatness, insulin levels, lipid profiles, and circulating concentrations of IL-6 proteins and C-reactive proteins measured at baseline and after intervention. The intervention group participated in classroom sessions once a week devoted to nutrition education and diet modifications. Additionally, students took part in aerobic exercise programs that consisted of dance and non-contact kickboxing at least 3 times a week. Results demonstrated that the intervention groups had significant decreases in percent body fat, BMI, and circulating concentrations of CRP proteins, both for male and female students. Other school health-based intervention studies in children have shown to produce similar results. In 2004, Dr. Alicia Datar and Dr. Roland Sturm conducted a study examining the effect of physical education instruction time on BMI in elementary school children. Data collected from a national sample of 9,751 kindergartners in the United States concluded that The addition of 1 hour of physical activity per week significantly reduced BMI in girls who were overweight. A slight reduction was also found in boys, but the article did not deem this statistically significant. Goobers and colleagues also found similar results in 2007 during a study that looked at lifestyle patterns, physical activity, and the relationship with BMI in children. Data collected from a previous study on elementary school children found that physical inactivity and poor nutritional habits were associated with increased BMI. School programs that focus on health education and increasing physical activity have shown to decrease obesity rates. However, childhood obesity rates are still rising, increasing the need for our nation to adopt a standardized plan for increasing health and physical education in our schools as we know it, in hopes to eventually wipe out the obesity epidemic. An example of the type of collaboration we're talking about in this document is demonstrated by the partnership of Massachusetts Department of Health with Blue Cross Blue Shield of Massachusetts. Together, these two organizations implemented a school-based initiative called Healthy Choices, which focused on childhood overweight prevention across the state. Similar to some of the successful interventions documented above, the program was designed to increase the opportunities for youth to participate in physical activity programs and increase health education. Evaluation of the collaboration demonstrated a positive intervention effect on BMI and nutrition education. The overall take-home message from this report is that collaborating partners can share resources, creating a better product than either one could alone. Partnerships such as this one, documented in the report, may potentially be the key to the implementation of more school health interventions nationwide, which in turn will combat the current obesity epidemic. To go ahead and wrap up this argument, I'll end with this. Currently, childhood obesity is at an all-time high, resulting in severe health and financial problems for our nation as a whole. The prevention and treatment of this epidemic starts with the increased implementation of health and physical education in our schools. Research has demonstrated that increased physical activity and health education in schools is directly related to the decreased obesity rates and overall improved wellness for our youth. At this time, our nation is searching for an effective plan to increase the amount of health and physical education in our schools. Collaborations between organizations and state agencies have shown to offer improved resources for school interventions and may be an effective model for fighting childhood obesity going forward. More research in this field is still needed in hopes to increase advocacy for such programs. Thank you, and have a nice night.